AM 1430 KRGI, 105.5 FM. Good morning. I'm Brian Gallagher. We get a chance to get caught up on things with what's going on with the Central District Health Department. Therese Anderson has stopped by to bring us up to date on some news moving forward. Welcome back.
Good morning, Brian.
So did you have a lot of trick-or-treaters last night?
No, Tuesday night, not so many.
Yeah.
Kind of chilly.
Well, and our neighborhood tends to be a little remote, but we probably had 20.
Yeah.
And so we planned accordingly, and there's not a whole lot of bag of leftovers, and so Denise decided to hang on to that, and now it's going to turn into Christmas candy.
Yep, exactly.
So sometimes it's just good planning.
Yep.
Let's talk about things that we need to make folks aware of. As much as I hate to say it, we're not done with COVID, may never be done with COVID, but there is some new things, good and awareness that we need to share.
Yeah, COVID can make us feel so fearless or fearful, I guess. And so what we want to talk about is one way that we have now of knowing what the level of COVID is in our community. And we've had it for a good year anyway, and it's the wastewater analysis that we do once a week. We have an agreement with the city of Grand Island to send these samples to UNL, actually, and through DHHS at the state level to let us know what the level of COVID particles are in the wastewater. It gets in the wastewater through what we flush down the toilet, to put it gently, and then we measure it to see where we are in the cycle of COVID.
As we get ready for colder weather, do you see direct effect because of the weather change, or is it just where the virus is today?
We were just talking about Halloween, and we're talking about Christmas and Thanksgiving coming up. People are starting to congregate together. It's cold outside. People tend to spend more time in close quarters, and so the virus has a chance to spread, and that's true for any virus. When you're closer together, you're more likely to catch something.
So it's more contact as opposed to being a direct weather effect.
Right, and we know that we know now that it's spread through the air. So anytime you're around someone who's breathing, then you're more likely to catch the bugs that they are exhaling.
I've seen more masks. I'm aware of more cases that have developed here recently. And you talk about how the wastewater tests are indicating that it's out there and we need to be aware of it. A few weeks ago, there was talk about a new virus antidote or treatment, but there was a short supply right away. Is that over? Is that solved?
That's the Paxlovid,
okay.
And it was free for a while. When we were at the height of COVID, we had free vaccine and we had free Paxlovid. Now I think there's a cost to it, but it works. If you get it by the third or fourth day at the latest, then it actually reduces both the length of this illness and the severity of the symptoms.
So that's if you have been affected.
Right.
But the vaccine is still designed to prevent.
Yeah, in public health, we like to prevent illness, and so we really promote getting the vaccinations. When we first started this about a month ago, we were in short supply, but now we have plenty of vaccine for anyone 6 months and older to get a booster if they haven't had one yet this year.
We're talking with Therese Anderson from Central District Health Department, the latest on COVID. Anything else that has come up through the research or just discoveries that have been made?
Every Tuesday we're on a conference with the folks that are in the know at the state level for the Center for Global Health. And what we're knowing now is that this virus continues to mutate. It continues to change its form. And so our bodies may or may not recognize it from our last vaccination or from if we've had the illness. So it's important to get the new vaccine so that we stay ahead in the game. We know right now that the wastewater is about where it was, the level's about the same as it was a year ago, and that was right before we went into this surge over the holidays and in January. So will it do that again? I don't know, but we want to be prepared.
So preparedness, vaccine is recommended to try to help offset it. Otherwise, the cleanliness aspect, make sure you wash hands. It's hard to say with the holidays, but you do want to limit contact or at least try to still give yourself some space I think that personal space aspect was something that it took time for us to adjust to over the last 3+ years.
True.
But it's real. It's just something that we have to be aware of and try to adhere to.
And the big thing is, if you don't feel well, stay home. Don't expose other people. There are individuals out there who, if they get COVID, are at high risk for hospitalization and even death still. So we want to avoid that. We want to keep other people healthy by keeping ourselves healthy.
All right. If folks have a question, how can they find out more?
Call us at Central District Health Department, 308-385-5175.
Teresa Anderson from Central District Health Department, thanks for the update.
Thank you, Brian.
Good morning from AM 1430 KRGI, 105.5 FM.